Hello, my name is Lisa. I am the charge nurse here on Blake 6. Blake 6 is the only dedicated transplant surgery floor at MGH. We have a wonderful group of nurses, doctors, social workers, pharmacists, case managers, nutritionists, and physical therapists that are dedicated to caring for transplant patients. We are excited to work with you and your family. This video was created to help you become familiar with the plans during your entire transplant admission with us. We as a team want you to feel comfortable and involved in your care, which is why this is important to view before your transplant. We encourage you to share this information with family that will be assisting you before, during, and after your transplant.
Hi, my name is Tina and I'm one of the liver transplant coordinators here at Mass General. First, let's start to discuss when you get the call about an available liver. You will be informed by the Buckeye Transplant Coordinator that there is a potential organ available. You will be told to come to the MGH main campus and report to Blake 6 or another unit depending on floor availability. You will be told at that time to stop eating and drinking. Please make note of when the last time you had a full meal and anything to drink, as you need to have as much of an empty stomach before surgery as possible. It is important for you to make the Buckeye coordinator aware if you have any current illnesses or infections other than your liver disease when you are called with an offer.
When you arrive to the floor, you will be seen by transplant surgeons and nurses. Multiple labs will be drawn, admission paperwork, consent, and other pre-op testing will be done, including chest x-rays, EKGs, etc. The surgeon will keep you posted on any OR times and/or updates. Every organ being considered for donation is evaluated in the same way to ensure that the organ is the best one for you. The transplant surgeons will inform you if there is any concerns with the donor organ. This can occur for many reasons, including donor biopsy or lab results, appearance of the organ, and/or donor history. There is a possibility that the surgeon may tell you that the liver is not the right match for you. This has happened before and is not unusual. Please be aware that the surgeon may tell you that the organ is not the best match for you anytime up until you are in the OR. While this is disappointing and unsettling, the transplant team does this to ensure that you have the best potential outcome. In this case, you would be able to return home if you had a ride home or if you can drive yourself. If you are a diabetic, monitoring of blood sugars will be done throughout the hospital admissions. Blood sugars may vary depending on medication changes, etc. We ask that family and visitors follow instructions given by the nursing staff regarding waiting rooms and how they will receive updates from the transplant team during or after surgery. It is highly recommended to delegate a point person for your entire hospital stay to help report information to any family members and/or others you would like involved in your care. This helps us keep you and your family updated as much as possible. Pre-op immunosuppressant medications will be given to you prior to going to the OR. Once taken to the OR, anesthesia will be placed in at least 2 peripheral IVs, as well as a large IV in your neck. This is for access during and after surgery to give medication, blood products, and fluids. Peripheral IVs will stay in place until the day of discharge for fluid repletion and medication. A special IV will also be placed in one of your arteries to be able to closely monitor your blood pressure in the operating room and post-surgery while you are in the intensive care unit. IVs will stay in place until day of discharge for fluids and medication. A urinary catheter is placed in the operating room. There is a possibility of 1 or 2 small drains called JP drains that are placed near your surgical incision to drain fluid from surgical site. These drains stay in place and your nurse will monitor their output. The surgeons will determine how long they remain in place. Finally, the anesthesia team will place a breathing tube while you receive anesthesia and pain medications during your surgery. This procedure is called intubation. It can be common to be intubated for a short time while in the ICU. Many patients are intubated for at least a day or so post-transplant. Some patients arrive to the ICU with the breathing tube removed. To note, sedation is given to you to tolerate the ventilator assisting breathing for you. Sedation medication will help make you comfortable. When your family comes to visit, you may look like you are sleeping, and we encourage family members to visit to talk to you. All team members will be monitoring these medications and continue to assess how long you need to receive these medications. Surgery can take about 6 to 8 hours at a time. It may be longer. Please tell your loved ones not to be alarmed by the length of the time. Also, family members are usually updated at the closing when the transplant center is finishing up surgery.
Hi, my name is Lisa, and I'm the attending registered nurse of the Blake 12 ICU. The Blake 12 Intensive Care Unit is the first unit you'll arrive to after having your transplant. Blake 12 is an intensive care unit that specializes in liver transplants along with other surgical procedures and medical complexities. This unit has a team of highly specialized nurses, doctors, respiratory therapists, and other healthcare team members all dedicated to you and your family's care. The intensive care unit team includes the nurse assigned to you, your responding clinician, the ICU attending, and your primary transplant surgical team. Once you arrive on Blake 12, the intensive care team will settle you. We recommend that family members and visitors call Blake 12 prior to coming for a visit. This will help to ensure we are prepared for their arrival. Your family will have already been updated about your surgical course from a member of the transplant team and providers from the Blake 12 ICU team. We encourage loved ones to designate one person to communicate directly with the team during your entire hospitalization. This will allow for the staff to focus on helping you recover after surgery. Right after surgery and once you are in the ICU, there are a few crucial items that need to get done. These include assessments done by the nurse and doctor caring for you, blood work drawn looking at your blood counts, electrolytes, and liver function, a liver ultrasound to look at liver function, a chest x-ray. Pain management is also monitored frequently, and your assigned nurse will give you pain medication through your IV until you can tolerate sips of fluid. You will then have pain medications administered as needed in pill form. If you feel that your pain is not being well controlled, please let the nurse and providers know. Based on your blood cell counts, you may need to receive blood products, which might include blood, platelets, or plasma. If this is needed, the team would let you know and discuss why it is needed. Kidney function is monitored from your lab results and how much urine you're making, also known as urine output. Urine output is monitored hourly while in the ICU. Kidney function labs are first monitored every 4 hours after transplant and then less frequently after the next day or two. Blood work is monitored every 4 hours for the first 24 hours post-op. The frequency of these lab draws will decrease over the next few days post-op. Blood sugar management is monitored very closely during your hospital stay as well. Certain medications may increase your blood sugar, causing a possible need for insulin. This applied to both diabetic and non-diabetic patients. The nursing staff will monitor sugars hourly while in the ICU, and the frequency of this will decrease over the next few days. Elevated blood sugars affect healing and liver function, and you may need to be on an insulin drip to help control the blood sugars temporarily. If you already have diabetes, an endocrine consult will be placed to assist the team in blood sugar management. Nutrition is an important role in the healing process after your surgery. The registered dietitian and the transplant team will be monitoring your nutrition status after surgery. Your nurse will be making note of what and how much you are eating and drinking. There is a possibility that you may have to have a feeding tube to help provide more nutrition during your recovery. If you have a drain or two, the output of these drains is monitored until they are removed either in the ICU or Blake 6. Confusion is common. This will reside once your new liver is able to metabolize and excrete ammonia. Confusion can also occur due to pain medications, stress, infection, age, change in environment, and this confusion will resolve. The nurses and providers will continue to support you and help reorient and direct you during any episode of confusion or altered mental status. Your well-being and safety during your hospitalization are of the utmost importance to us. Your nurses and the transplant team will keep you and your family updated on the plan and ability to transfer out of the ICU to Blake 6. Everybody is different. Don't become discouraged if you spend a longer time on Blake 12, Blake 6, or in the hospital. There are several requirements that must be met before leaving the ICU, which the nursing staff and the transplant team will be assessing daily to make sure that it is safe for you to transfer to Blake 6. You may start working with physical therapy before you are transferred out of the ICU. This would happen after you are extubated, the breathing tube removed. If you do not start PT before you transfer, you will work with a physical therapist on Blake 6. Once transferred to Blake 6, there is a small chance you could become unwell enough to be sent back to the ICU for treatment that can't be done on Blake 6. Being on Blake 6 means that you will be closer to returning home or going to rehab. You will be required to do many things, including the next few important yet crucial steps.
We will get you up and moving while you are down here on Blake 6. Your nurse and/or PT will come and work with you daily. You are expected to sit in the chair for all meals and expected to ambulate 3 to 4 times a day. You can walk with your nurse and/or family for assistance with lines and tubes. You will be weighed on the standing scale in the morning for the team to assess fluid balance discrepancies. Every day you will be weighed by 10 a.m. We encourage that family who will be coming in for teaching to plan on being on the floor between 11 a.m. and 3 p.m. Please tell the nurse as to what days and times your family is available for teaching, so all specialists can educate you and your family for discharge. Visiting policies change from floor to floor, so please check in with your nurse before visitors come in. We do not allow overnight visitors per hospital policy. We want all patients to have a restful night's sleep, and it is important that your family and support get rest as well. Transplant pharmacists will meet with you and your designated caregiver, whether it's a spouse, family member, a friend, etc., who will be with you for 1 week after surgery to review medications. This is expected of all transplant patients and their support systems, as these medications are vital to the well-being of your new liver. You will get a medication card, which will help you learn your medications. Along with keeping track of doses and times that you take these medications, all doses will be written in pencil to make sure it's easier if adjustments are made to doses. It is crucial that you always keep this with you and that you take the dosage of medication as indicated on this card. The pharmacist will review more in-depth education on medication, but you will be reviewing this with your nurse and be expected to become familiar with your medications during your stay prior to discharge. Your nurse will make sure that the medication card is up to date before you are discharged. You will be monitored closely for signs and symptoms of rejection by the nurses and the transplant team, both while in the hospital and after discharge. Rejection is always a possibility, and it is not uncommon for this to happen. This does not mean that you will lose the liver, but you may need additional medication and/or adjustments of your medication. You may require a liver biopsy or medication, which would mean you would need to be in the hospital. The most important thing you can do is take all your medication as prescribed and follow your med card. The case manager will work with you, your family, and the team to help organize your discharge needs and will meet with you once you are on Blake 6. The case manager will be working with your insurance company to organize medication approval, delivery, and refills, as well as any discharge services that may be necessary, such as rehab placement, visiting nurses, or home physical therapy. Please keep in mind that you may be discharged home or to rehab within a few days after leaving the ICU. It will all depend on your course after surgery. Transplant social workers are available to you while you are in the hospital if needed to help provide support during your healing and recovery. We also offer spiritual care services if you would like to have a visit during your hospitalization. Please let your nurse or physician know what we can do to best support you and your family during your recovery. Medications will be processed at Walgreens Specialty Pharmacy, which will provide a 1-month supply of medication. These meds will be delivered to the floor so that the patient can have home meds provided prior to discharge. At the follow-up transplant clinic appointment, the patient can inform staff there on which pharmacy they prefer for medications to be obtained from that point on. Pain medications must be picked up in person according to the law. The provider will send an electronic copy to your pharmacy of choice. The attending nurse, or ARN, on Blake 6 will meet with you and your family members prior to discharge to review postoperative education. This will consist of knowing and verbalizing the signs and symptoms of rejection and infection, along with who and when to call the transplant team for emergencies and/or questions. Other information will be provided, and we encourage that family is present for this vital information. If you have a drain and the transplant team has decided to keep the drain in place on discharge, education on drain care will be given to you and your family members by your assigned nurse. Handouts and education videos are available to best suit your educational needs. If you or your support person do not feel comfortable with drain care, a visiting nurse can be set up to help you at home. Now let's discuss the discharge process. When the team has determined that you are ready for discharge from the hospital, multiple things will need to happen before you can leave. A discharge order needs to be placed, your IVs will need to be removed, medications will need to have arrived from Walgreens and checked by the nurse, and you will need to have a ride set up. Once all these things have been met, you will be able to review your discharge paperwork with your nurse, and you will be able to go home. You will also have your educational binder, Caring for Yourself After Transplant, which will have all educational materials, logs, and information that you will need to have with you after transplant. This binder will need to be brought with you to all your post-op appointments. This binder is conveniently located on the Transplant Center's webpage for easy access for your family members and other supports for their review. As mentioned before, it is not uncommon if you need to be readmitted after you have been discharged. This does not at all mean that your liver is in danger. We want to make sure that your new liver is in the best shape possible and will continue to monitor you after surgery.
For any further questions, we encourage you to call the transplant clinic, which can then be directed to the physician on call. If you have questions that arise before your first clinic appointment, please call Blake 6. Follow-up appointments will be at the transplant clinic, which is located on 165 Cambridge Street above Whole Foods. You will not return to Blake 6 unless you are admitted again. For emergencies, we urge patients to go directly to the ED or call 911. Thank you for your attention. We want to welcome you to the Transplant Center at MGH. We look forward to working with you.